Right. Good afternoon, and welcome to today's program, Taking an Active Role in Your Health, a Capital Blue Cross presentation. I'm Nicholas Cunningham, the Program Manager of LVAIC. We have a great presentation for you. Jen, last name again, please.
Potato.
Jess,
Carrot.
Car- Jen Carricato from Capital Blue Cross is joining me today. Jen is a senior health educator consultant at Capital. Today, she will be speaking on the true costs of healthcare and medical self-care and introduce Capital's digital diabetes program. Before we begin, I have a couple of quick housekeeping announcements. Firstly, please be aware that we will be recording today's presentation. Secondly, we'll be saving all questions until the end of the presentation. We will pause the recording during the Q&A to respect everyone's privacy. And with that, I'm going to turn everything over to Jen. Thank you, Jen.
Thank you, Nick. Hi, everyone. Again, thanks so much. I'm Jen Carricato, Senior Health Education Consultant from Capital Blue Cross. And I'm going to just turn off my video. It's about to thunderstorm where I live, which is about 2 hours from the valley. So it looks pretty brutal. So I'm going to hopefully save some bandwidth by turning off my video, and then I'll get started. So yes, today we're going to talk about taking an active role in your health. And then throughout the presentation, we will talk about the true cost of healthcare, as Nick mentioned, as well as health consumerism, managing medical self-care, and then also the services, programs, and products that Capital offers at no cost to you as the participant. So about 6 in 10 adults in the US have a chronic disease or a chronic condition, and 4 in 10 adults have 2 or more chronic conditions. Chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living, or both. And so chronic diseases such as heart disease, cancer, diabetes are the leading cause of death and disability in the United States. And they're also drivers of the cost, the nation's cost, which is around 4.1 trillion in annual healthcare costs. So taking a closer look at some chronic conditions, they're caused by a short list of potential risky behaviors. You can see on the slide, tobacco use is the first one. So 13.7% of all adults, about 34.2 million people, and 15.6% of men, 12% of women in the US use tobacco. And that could include vaping, cigarettes, chew or dip, all kinds of, it's tobacco in general. So smoking costs in the United States, the cost of smoking in the United States is about 300 billion per year, including nearly 170 billion in direct medical care for adults and more than 156 billion in lost productivity due to premature death and exposure to secondhand smoke. Next, we have physical inactivity. So physical inactivity accounts for roughly 8.7% of the US healthcare expenditures, or approximately $117 billion per year. And adults who are physically active spend about $1,500 less per year on healthcare than inactive adults. Only about 1 in 4 US adults and 1 in 5 high school students get the recommended levels of physical activity. Not getting enough physical activity comes with a high health and financial cost, as it can really contribute to these other factors, chronic diseases that we just mentioned previously. So heart disease, diabetes, type 2, several types of cancer, as well as obesity. And so in addition, low levels of physical activity, again, are associated with really high healthcare costs every year. Additionally, poor diet, so unhealthy diets account for almost 20% of US healthcare costs, from heart disease, stroke, diabetes. And so then additionally, overweight and obesity. Obesity affects 19% of children and about 42% of adults. And you can see how all of these kind of tie together. So physical inactivity, a poor diet, causing overweight and obesity, and then that increases the chronic disease states such as diabetes, heart disease, and some cancers. And then in addition, stress, physical complaints, so migraines, joint pain, skin problems arising from excess stress account for approximately 25% of all primary care visits in our country. And the total estimated cost of work-related stress was observed to be considerable and ranged substantially in the US, from about 22 221 million, I'm so sorry, to 187 billion. And then productivity related losses were observed to proportionately contribute the majority of the cost, with healthcare and medical costs comprising of the remaining 10 to 30%. And then last but not least, these unmanaged chronic conditions, so unmanaged blood pressure, diabetes, heart disease, all of the chronic conditions we just talked about lead to higher medical costs and higher rates of absenteeism, reduced productivity, and then the number of adults who don't know that they have diabetes or have an undiagnosed high blood pressure is very great. And that's why regular screenings are truly paramount to maintaining good health and the costs associated with treatments for those conditions. And so the rising cost of healthcare, some of these factors that are driving the cost of healthcare, such as increasing medical technology, the rise in chronic diseases, the rise in rates of overweight and obesity. So if you look at these, of these three, an individual can control at least two of these. We all certainly can't control the cost of medical technology, but we can control the cost of our own chronic disease, of our rates in overweight and obesity. So hospital care and physician clinical services combined can account for half of our nation's health expenditures, and healthcare costs for chronic disease treatment account for over 75% of national health expenditures. So what does this mean to you? What does this mean for us? Just, something to think about on your own after hearing some of these statistics, contributing factors, what are raising the healthcare costs in the US? What does this mean to us as an employee or an individual? And then we'll look into some things that we can help to reduce the rise of healthcare costs. So healthcare consumerism, you may have heard this term medical consumerism or health consumerism before, but what does health consumerism truly mean to you? Again, something just to think about. By definition, medical or health consumerism is the concept of patients taking responsibility for their own medical care decisions using background information acquired by combining self-assessments, physician and or provider input, background research, interviews with other influencers. So that could be if you have other doctors, if you have a team of doctors, you could talk to your pharmacist. There's a variety of ways and people that have this knowledge where you can kind of get that second opinion. And the cost of care to make informed decisions about your health. And so why be an active health consumer? Truly to be a part of the team, with you and your doctor or your practitioner. By actively taking part in your healthcare, you can empower yourself to make the best and most informed decisions about your health and treatment plans, tests, and procedures. You should be asking questions, and we'll get to some of those questions in just a minute. But asking questions is extremely important when it comes to your own treatment, your diagnosis, considering different treatment options, and research clinics or hospitals that will potentially cost you less for the same test or the same procedure. I was just at another event and I was listening to someone talk about how they were really their own medical consumer, really helping. They were pregnant and they didn't want to do the diabetes. They had done their own research that the sugary drink that you drink when you're pregnant to test for diabetes, gestational diabetes, they didn't want to drink that because they had done some research that in Japan, it's not as safe. And so the research that was done in Japan has showed that it's not as safe. And so they talked to their doctor about what they could do instead of drinking the drink. And what the doctor and the team came up with was that this person could actually test their blood sugar daily for about a week. And then that would provide them with the same information they would have gathered had this person had the gestational diabetes liquid that they typically take. So I thought that was a good example of empowering someone to, make their own decision, but work with their provider team to really do the right thing, but also, have another option when they had done their own research. And so being a wise health consumer has many benefits. Again, it encourages and empowers individuals to improve their decision-making skills when there's multiple sources of information and opinions that can sometimes even be conflicting. So when there's a real medical emergency, if you have kind of this plan or these, ideas and you're discussing those with your doctor about alternatives, when and when not to see a physician, when and how to treat oneself at home, also when to use outpatient rather than inpatient services, and then also when diagnostic tests are appropriate, and then also how to question a provider's recommendation. So just as the example I used, sometimes we don't feel very confident or comfortable kind of questioning the doctor, but there are ways that you can do it that is, again, you being the medical consumer and just asking the questions to gather more information. It really does teach us, the individual, on how to select a physician. We can communicate with medical providers, how to manage our medications. It also helps individuals understand the importance of complying with those preventive exams that I had mentioned previously, and then also assessing treatment options based on the relative benefit, risk, and costs. And then it also refers to making efficient and appropriate use of medical services and informed health decisions, again, such as benefits like medical self-care. And we're going to take a look at some of those benefits of medical self-care in just a moment. So medical self-care is not to be confused with self-diagnosing. Medical self-care really does promote medical consumerism. It provides decision-making support and decision-making support tools for determining the appropriate or necessary use of emergency or outpatient services. Medical self-care programs create a foundation for developing the complex decision-making skills needed when faced with major health events. Research clearly demonstrates that when encouraging healthier choices among employees, employers are reaping the long-term savings in terms of sick time, disability, and healthcare costs. And while as individuals may not always be looking to reduce, the cost for our employer necessarily, but it's also in turn lessening the cost for you. So it's really important that we have that twofold situation and we really consider both sides. Companies that have effectively developed a wellness culture also realize cost savings in relation to retention and recruitment, reputation, employee presenteeism, which is, again, employee engagement. So again, really important to really focus on medical self-care and to learn how to, to continuously learn and educate yourself on what medical self-care is and what that looks like to you, the individual. So some points to consider: being proactive, so selecting an in-network physician, one who is dedicated to providing coordinated care. Coordinated care is truly the synchronized delivery of a person's health care from multiple providers and specialists. So the goal here to have that coordinated care and the importance of having coordinated care is truly the goal to improve health outcomes by ensuring that care from a variety of providers is delivered in coordination, eliminating and reducing healthcare costs by eliminating multiple tests that they may not need or you may not need, as well as procedures. And then also it can include, easy access to a range of a variety of services and providers, effective care plans and communication between providers. So if you think about if you go to the doctor and you're kind of in the same system for all the things that you're going to the doctor for. So I'll use myself as an example. If I go to my PCP for something, I go to my allergist for something, I can see all of that information, in my portal. I can ask questions from my doctor. My doctor can see what my allergist is saying and vice versa. So again, just having that coordination of care, and then also talking to my pharmacist, who is not necessarily part of that system. But if I have a question about my medications, or I need to ask a question about something my PCP gave me, or maybe my allergist gave me a medication that I'm not going to take all the time, but just to make sure that it's not going to be an issue to take them at the same time. Also being aware, so understanding your current health status, keeping a personal health record or diary, so writing down dates of your tests and the results, treatment recommendations. You can also oftentimes your health system, if you are in a health system, I think this is really important to have a PCP so that you do have access to this information. And if you don't access your portal, if you have access to one, I highly recommend getting in there and just seeing, you have your after visit summary, you have information about your lab work, if you have it, things like that, where you can, if you do have questions, go back to that site and ask your doctor or your, even the pharmacist, be able to print those items if necessary. So then also knowing your numbers, I know I just mentioned that, but really having your basic biometric screenings done so that you have your lab work and you have your baseline, having them repeated periodically to monitor the progress. If you have out of range results, again, talking and working with your doctor to see how often that might be needed for you, the individual. Also know the value of care. So understanding cost differentials, asking questions, preparing questions for your provider before the appointment about the need for testing, what the diagnosis is, what they're looking for, what your treatment plan might be moving forward, what medications they might be suggesting or prescribing, and then alternatives to treatment or medications. All of those things are extremely important. And if you're not getting the answers from that PCP, talking to, the manager of the office, but also maybe considering a different PCP if you're not able to talk to your doctor. You should absolutely be able to ask your doctor questions, and they should be able to give you answers that they understand or that you understand. Capital has a program or a on the portal, My Care Finder, and I'll talk about that in a little bit in addition to this section, but it really allows you to be a good healthcare consumer to locate a doctor or a provider, not just a PCP, but if you, again, an allergist, a cardiologist, physical therapist, you can look for hundreds of services to find the best value for your healthcare, and it can be found at capitalbluecross.com under the Find tab at the top. And again, you can compare these doctors, they're rated. You can look what other people say about them. So again, and you can also look at the cost of care for those particular sites. So again, just another tool that you have access to through Capital at no cost to you. And so taking control of your health. So again, getting most from your visit, we talked about writing these questions down, practicing them and voicing them confidently at your appointment. If you can take somebody else with you to your appointment, especially if it's something that's pertaining to a chronic condition and not just a checkup, this can be really beneficial to have somebody there with you, because at times, even those of us who even work in the field could be very nervous when we go to our doctor's appointments and we have questions and we just don't feel comfortable or confident, or maybe we just forget because we're a little bit overwhelmed when we're sitting there talking about the condition that the doctor's giving us information that we might just not be familiar with. So again, important to be well prepared, take part in the decisions about your care, asking your healthcare provider to provide a summary, sum up the main points. And then again, if you have access to your portal, taking a look at that after visit summary that again should have those same bullets, if not maybe some more detailed bullets. Also being involved with your pharmacist. Again, when the process is appropriate, your pharmacist is the expert on the medications and any implications there may be with the drug, any drug interactions, also less expensive generic alternatives. You can ask to have those. That is something that you can absolutely talk to your pharmacist, and they are a key member of your healthcare team. So here is the list of the questions that I was referring to that you can ask your doctor. I can also send these after if that would be helpful. I can put them in a Word document or in an email, and I can have Nicholas send those out. But what are the most important things I need to remember when I leave the office? Why have you recommended this course of treatment? Are there alternatives to the recommended course of treatment? If so, what are they? What can I do to reduce my health risks in the future? And if I have additional questions, how will I get them answered in a timely manner? And these are just some basic questions to take. You might have more specific questions, and that's perfectly fine. We just hope that this is a very brief guideline that you could use when you need to go to the doctor. So preventive screenings. I've mentioned these often throughout the presentation so far, but it is really important to pay attention to regular and important health screenings. It's one of the easiest ways and important ways that you can, live a long and vital life. Regularly scheduled screenings help identify potential health problems in the early stages, and then therefore may be easier to treat. Testing methods could include, but are not limited to, lab tests, so blood work that we talked about a little bit already, your biometric screenings. That would include blood lipid levels, which test for lipid levels in your blood. So that's your HDL, your LDL, also glucose levels, physical exams, potentially radiographic exams. So females have mammograms, sometimes males may have a mammogram, colonoscopies, endoscopic procedures, things like that. And so I highly recommend taking a look at the preventive schedule based on your age and gender to see what preventive exams or options are available, to you, again, based on your unique situation and individuality. Also, participating in health education programs. I see some familiar names on the screen, so I know that some have participated or have initiated some employer-sponsored programs. So Capital and the team that I work on, we are here to support you as an employee. We have programs designed for both the improvement and maintenance of employee health, and management of chronic and acute illnesses. We offer up-to-date and comprehensive selection on health management programs. We proactively address lifestyle risk, and we continually provide disease and care management services. And we really hope to achieve high levels of engagement in programs within every risk stratification. So if you do have questions about some of our programs, I'm going to go into some of those that are offered by Capital at no cost to you, the individual. But if you do see Capital sponsored programs within your LVAIC schools, please consider joining and engaging. We're here to help, and we love what we do. So I'm going to go through these each individually. So we're going to talk about our self-care products and programs. We'll start with virtual care, then we'll talk about the Connect Health and Wellness Centers that are close to the LVAIC schools in the Saucon Valley. And then digital diabetes program, I'm going to spend, I actually might move that one to the bottom because I know we want to spend a significant amount of time on that one. So I'll go through the other ones and then we'll come back to the digital diabetes program. We'll also talk about the digital maternity and family program, which is called Ovia Health, and then our Healthy Rewards program, our care management programs, and then Blue 365 and Tivity Health, which is some of you may be very familiar with. It's the gym membership program, but also offers a variety of other discounts as well. So working with a care manager. So our case and care management programs are free. We use specially trained care managers. They provide important education to help those individuals manage your condition, personalized one-on-one support by phone. They help you follow a treatment plan that's been prescribed by your doctor. Doctors can, recommend that the care management team. You can self-refer to the care management team. If you require complex medical care, someone, on your plan does, our Blue Cross case management program is available to you and your family to really help you make informed decisions, help manage your care and maintain your quality of life. Typically those are trained nurses, so RNs, social workers. We have our behavioral health staff as well. It is really important. I always say, we talk about this all the time in some utilization reviews and things like that, that the case and care managers are calling to help. We're not trying to, bombard you with anything, or we just want, again, they just want to help, and they're not here to replace your care team if you already have one. It's just an additional resource. And I think that's really important, just to, get that message out there, that they are really just looking to help. And if you need anything, they just want to provide those resources that you have available to you. So some focus areas include asthma, congestive heart failure, coronary artery disease, diabetes, and high-risk maternity. These are, just some of the topics that our care management team, outreaches based on eligibility. And so Blue 365, this is what I had mentioned as some of the discount programs. So this is available through the Blue Cross and Blue Shield Association. Blue 365 offers exclusive discounts to health and wellness, variety of different health and wellness vendors. Members have access to selected national and health and wellness resources and services at discounted prices. And these kind of change regularly. So it's always good to check it out when you have time, and just see if there's anything of interest. And then in addition to Blue 365, we have our Activity Health, which is part of Blue 365. This offers capital unlimited fitness membership. So if you're a member, you have to join Blue 365 to get the discount for the gyms. And I highly recommend that you check to be sure that your gym is in network with Activity Health before you sign up. That way, you know that you're getting the gym that you want to go to. And this would be for individual subscribers. So if you have, children on your plan with Capital Blue Cross, each person, they have to be 18. So if you have, you, the subscriber, the spouse, and then 2 children of 18 or older, then all 4 would have to have a separate Activity Health membership, but you can certainly do that. Next is the My Care Finder tool. This is what I was referencing earlier, but really, again, you can view providers by going to capbluecross.com, clicking on Find, then Doctors, and then you can look for doctors, specialists, and facilities, again, based on quality and other preferences that you put in there. Informative and provider facility profiles. You can see the nationally recognized quality measurements, and this can help you, make your decisions on where you're going. It also shows estimated out-of-pocket costs, treatment timelines, and incentives, potentially if you have this program based on plan benefit status. But cost estimates are presented in context at the level members are researching, so treatment and encounter service level, allowing members or us as the individuals to really see the big picture down to the details. So benefits-based pricing and claims data provide cost estimates and timelines for care, and really take that into account in the members' network coverage, health plan benefits, and potentially your deductible. So I do highly recommend, if you don't have a CAP or you haven't logged into your capbluecross.com account, I highly recommend creating one. It is a wealth of information and resources for you. So not only do you have access to the My Care Finder tool, but you also can view your ID cards on there if you needed to print one. You can, email it to yourself. You can also see your EOBs on there if you get them. There's a lot of information on the Cap Blue Cross portal that is not just My Care Finder. And speaking of, so we also have our virtual care. This used to be a separate app. It is now within the Cap Blue Cross app. So I highly recommend downloading that as well and getting this virtual care program set up before you need it, because when you're sick or your loved one is sick and you're trying to do it, put your credit card information in, it can be very frustrating when, if you have it set up ahead of time, it's kind of that, saying, do it before you need it. But our virtual care offers doctors availability every hour, every day of the week, even on holidays. You can just use virtual care right from your smartphone. They can call in prescriptions for you if needed. There's all kinds of, facilitators. So you can meet with a doctor for, if you have a sinus infection, if you have a migraine, there's a variety of different things that they will see you for. You also have access to registered dietitians for nutritional counseling. And then there's also counseling services within the app. And so sometimes it can be really challenging to get into a counseling center or on site. And so the wait time typically within our virtual care app is about 3 days, where it could be much, much longer if you're trying to get in with another facility. So again, I highly recommend looking into virtual care if you haven't already. It is a great resource. Again, not to take the place of your PCP or your therapist or, even a registered dietitian if you use one. Just again, more resources available to you. So then we also have our Connect centers. So this is the one I was referring to in the Silicon Valley. So we have certified health coaches, personal trainers that are there. And then they're able to, meet with you if interested. You could also do a virtual or on-site. You can also go to those retail stores for your biometric screenings. So a quick, easy, that would be at no cost to you. Also, if you have questions on your EOB, or if you have other questions about, your coverage, you can certainly take that information and talk to one of our account managers that are on site there. So again, another resource that you have. I'm going to skip this slide just for a moment, and then I'll come back to it. This is the digital diabetes program that I want to spend a little more time on for you. We also have our digital maternity and family support programs. So our Ovia Health app, again, digital resource for women's health, but also parenting. So men obviously can be a part of this app as well. So there's two apps. There's the Ovia Health app itself, and then there's the separate parenting app. So feel free to download either one. The Ovia Health app itself covers the spectrum of women's health from fertility through menopause. There's a lot of really great resources and information in there. There's also a good bit of information on overweight and obesity and things like that. So again, all tying together to preventive health, really important and key in staying healthy. We also have our Healthy Blue Rewards program. I believe the majority of the LVAIC schools, I think all of them have the light version. So you would have access to the health assessment. So feel free to take that. Also, then once you take the health assessment, that would lead to recommendations based on how you answer those questions, providing you then with suggested self-guided programs and resources based on how you answer those questions. So there's really a great wealth of resources within Healthy Blue Rewards. So I highly recommend. Also, you can get to the Healthy Blue Rewards through your portal. So again, downloading the either the app or using the website on the computer. Just so many resources that you have access to that can help with your health and wellness journey, but also providing you with some very useful information. Also, maybe some possible opportunities at your organization using your EAP. So they typically have a range of services, including family and marriage, stress, financial and legal challenges, workplace conflict. There's oftentimes they provide a certain amount of sessions or resources for free. So I highly recommend looking into that, what your options are and what that might look like to you as the individual based on what each of the colleges offer. Okay, so I'm going to go back to the digital diabetes programs, and then I'm going to stop sharing this screen and I'm going to pull up a flyer that I will also send out for Nicholas to share with everyone. But diabetes is a growing public health epidemic. There are numerous, studies. There are tons of national statistics, showing that, diabetes is just so prevalent in the United States. So just a few of those statistics: more than a third of US adults, about 88 million, have prediabetes, and about 1 in 10 people, 34.2 million, have diabetes. And so I think kind of the scary thing about prediabetes is that's just those who have been diagnosed with prediabetes, not those who have not had that diagnosis yet. So they might be well on their way to having prediabetes, and they're just not even kind of lumped into that statistic yet. The healthcare costs for people with diabetes are more than twice as high for those who do not have diabetes. And the risk for early death for adults with diabetes is about 60% higher than for adults without diabetes. And again, kind of going back to the prediabetes piece and not knowing. So about more than 8 in 10 adults don't know that they have prediabetes, and 1 in 5 people don't know that they have diabetes, which can be very dangerous if you don't know. So diabetes really does impact us individually, based on absenteeism, reduced productivity, and an inability to work, dependent on, how managed our diabetes are. And so we have been offering Omada Prevention and Management. It's, again, a digital opportunity to lose weight. It's also, so the prevention program really focuses on losing weight in a very healthful way. And you work with a professional health coach. You get connected devices that can be automatically linked to your account. Then you're also provided diabetes monitoring equipment and supplies if necessary, such as meters, test strips, wireless smart scale at no additional cost to the individual. And then there's a curriculum and resources on topics like healthy eating, managing stress, and improving sleep habits, all key measures to preventing or managing diabetes. You also get access to a community of participants who can help offer support and encouragement throughout the program. And again, the diabetes management program is not just for type 2, but also type 1 diabetes prevention, again, for prediabetes. And it's so you would fill out an assessment to see if you're eligible for the program. And then you get an email saying whether or not it asks you just a few questions. To be honest, to get into the program, it's pretty vast. So the opportunity to participate is pretty good. And so high blood pressure, being overweight, there's, again, quite a variety of eligibility requirements to allow for lots of opportunity to be in the program. And so again, the management program, you may get the test strips. You get those for free at no cost. Once you need more, you can get the prescription refilled. You get 2 CGM monitors. Again, this is for the management program. For prevention, again, it's really focused on weight loss and managing that weight loss in a very healthful way, working with health coaches. There's registered dietitians. You have a care team. Again, this is not to replace your primary care physician or your endocrinologist. This is really another resource, again, that is at no cost to the individual. So I'm going to stop sharing my screen, and then I'm going to pull up another document to share. And again, I'll have this have Nick send it out to everyone after the presentation for you to access. Okay. Can everybody see the document I'm showing?
Yep, can see it.
Great, thanks, Nick. Okay, so again, this kind of just reviews everything that I just mentioned, but it does, Omada is a virtual health program. It really helps participants lose weight and manage diabetes. You may be eligible to join either the prevention or Omada for diabetes. Again, each program provides expert guidance, one-on-one coaching and tools, and real-time feedback. It's really based on behavior change, and you can do it at your own pace, and it really helps you build confidence and feel better, kind of getting on that more healthful path. So again, who is eligible for the program? If you are an adult dependent or at risk for type 2 diabetes or living with diabetes, again, we cover the enrollment cost as the individual and the time commitment. It's really as long as you need the program. Um, Again, you all have access to this. And if there are some, LVAIC leaders on the call here, this is also something you can certainly share out to your staff and employees that they would have access to. And then you can see at the top right, what does the participant get? So again, health coach, a clinical specialist. So that's typically a registered dietitian or a diabetes educator. If they are diagnosed with diabetes, and then all the smart devices that they might need, personalized care plan, weekly lessons, and then tools for managing stress, as well as that peer group, online peer group and community for support. Again, I'm going to send this out, but this is just kind of showing what you would get. So for prevention here, you can see a personal health coach again, smart scale. And then, if you have been diagnosed with diabetes, and so you're in the management program, this is where you would have access to the certified diabetes specialist, 2 continuous glucose monitors, the test strips, lancets, and a smart scale. So again, I'm going to send this document out after our call, and then Nicholas can share that with everyone. And then, of course, if you have, Nick, I'm going to leave it open for questions. So I'm happy to send over the Omada flyers for you, and then you can send those out if that works for you. Or if you'd like to do it another way, just let me know.
Yep, that works well for me. So, first, before I continue, I just want to thank Capital Blue Cross, Jen specifically, for such an informative presentation. I know I learned some things, so thank you very much. So we really hope that you found this program valuable. I'm going to be dropping some links into the chat right now. First link is for any upcoming LVAIC events. So right now, we are pretty much wrapping up for the end of the semester. So this is the last one that we're having, as well as our mailing list. So you can sign up and get our registration link straight into your email, so you don't have to worry about checking for a separate spot. But I just want to thank you all for joining us this afternoon. We should have the recording and the slides available on LVAIC's website soon. So I hope you all enjoy the rest of your afternoon.
Yeah,
Thank you
have a great day,
again.
everybody. Thanks, Nick.
Bye. Thank you.